All right, thank you everyone for joining us today at this press conference regarding the first positive case of novel coronavirus or COVID-19 in Yolo County. Before we get started, I'm just going to share a little bit of housekeeping. My name is Jenny Tan, that's spelled Jennytan, and I am Yolo County's Public Information Officer. There is a handout with names and spelling, so if you do need that, please let one of our staff know. For those of you that are on the line, you are muted upon entry and you'll need to unmute yourself to ask questions at the end. If there are any mobile phones on the podium, or even if you have any on you right now, please silence them. And we'll try to answer as many questions as we can. If we do not answer your question, we are available offline to answer what you may need. Today we have 3 speakers. I'll be one. Our next one is our Yolo County Public Health Officer, Dr. Ron Chapman, and Yolo County Emergency Manager, Dana Carey. We understand that there is a lot of fear and anxiety right now in our communities. We are all living it and we are all seeing it. Yolo County has been communicating and collaborating with cities, schools, school districts, colleges, healthcare professionals, community members, and more. Yolo County has been sharing information and providing resources and prevention tips to the public through public service announcements, social media, email, over the phone, our COVID-19 webpage, which is www.yolocounty.org/coronavirus, and more. Because there is so much anxiety, we want to remind people to be kind to each other and show compassion, because we are all in this together. With that, I will hand it off to our next speaker, Yolo County Public Health Officer, Dr. Ron Chapman.
Thank you, Jenny. Appreciate all the media being here so we can inform the public what's going on. As Jenny said, we have our first confirmed case of COVID-19 in Yolo County. For privacy reasons, to respect the privacy of the patient, I'm only able to share limited information. The information I can share is the patient is an older woman. I can share with you that she has been hospitalized and that she's doing well. I can share with you what we know about the virus. We know that at least 80%, the vast majority of cases of COVID-19, of coronavirus, are mild, meaning that people have a runny nose, a light cough, they get better after a few days, and they never know that they've had coronavirus. There's growing evidence that coronavirus is already in our community and is spread widely. This particular patient was what we call a community transmission. It means that she didn't have any high-risk factors for getting coronavirus. She picked it up in the community, which again is evidence that coronavirus has spread widely. The folks that are most impacted and get the severe forms of infection are the elderly. And so the folks that we're seeing for the most part who are hospitalized, and the unfortunate fatalities, the deaths that we're seeing worldwide, are in the elderly. We're working very closely with our local healthcare providers, with the school systems, with other city government agencies and entities. We're all working together to partner to help protect the public from the coronavirus. We're working with the Center for Disease Control and the California Department of Public Health. It's been shared that we've declared a local emergency. You're going to hear more details about that shortly. I do want to share that when we have people that have known risk factors, such as being exposed to somebody that is confirmed as a coronavirus, we know who those people are. We're contacting those people, and we've actually had dozens of individuals who have been in home quarantine over the last 6 to 8 weeks. In fact, we've had upwards of 30 people who have done their 14-day quarantines and have been released from their quarantine. They've not had any symptoms of the coronavirus. The most important message that I can share is, just like when a person has the common cold or the flu, people need to stay home when they're sick. You don't want to come to work. You don't want to send your children to school when they're sick, because that just continues to spread the infection. When people are sick, if you have a cough, you need to cover your cough so you're not spreading the infection. You need to wash your hands regularly throughout the day for at least 20 seconds. And lastly, there's a lot of questions about masks. We're in a shortage of masks. The general public should not be wearing masks. There is no benefit to doing that. We need to save our masks for the healthcare workers who are on the front lines taking care of the people who are sick with coronavirus. At this point in time, we're not talking about closing schools or businesses. As the evidence grows regarding community-wide spread, we're going to be asking people to consider canceling the non-essential events, and we'll be talking more about what that means as the days go on. At this point, I'll turn it back to Jenny Tan, and then we'll have time for questions. Thank you.
Thank you. Next up, we have our Yolo County Emergency Services Manager, Dana Carey.
Good afternoon. My name is Dana Carey, D-A-N-A-C-A-R-E-Y, and I am the Emergency Manager here in Yolo County. Some other things that you're going to be hearing as part of our press releases and information releases such as this one is the fact that we are declaring a state of public health emergency and proclaiming a state of local emergency. Those are two specific declarations and proclamations that government will typically do in order to allow us to handle whatever comes our way in the future. A lot of times our local public health proclamation can access our emergency purchasing policies so that we can buy things faster, order things faster, take personnel who are normally doing work in our other departments and reassign them, in this case to help our Health and Human Services Agency. Our Emergency Operations Center has been activated for that specific purpose. That way we can take extraneous duties such as purchasing or finding vendors or simply documenting what we're doing and house it with the personnel in the Emergency Operations Center to free up the time of our public health professionals to do the very important work that's going to be needed in upcoming weeks, such as contact tracing and calling and staying in contact with patients. We'll be centralizing a lot of the functions that they were doing documentation-wise out of the EOC, again, just to aid them. So an Emergency Operations Center and our proclamations or declarations are something that's standard in our emergency operations plan, and they're designed specifically for things like this so that we can be stronger as a county and work together as efficiently as possible. With that, I'll go ahead and turn it back over to Jenny Tan.
Thank you, everyone. We are now going to open it up for questions if there are any.
Did you say it was picked up in the community? Can you elaborate on how?
So for those on the phone, this is Dr. Chapman. The question was how it was picked up in the community. And at this point, we do not know how it was picked up in the community. We're aware of other cases of what we call community transmission. Similarly, unclear how it was picked up in the community. This is just, again, very similar to how the flu and the common cold is passed from person to person. There are a lot of people out there that have very, very mild coronavirus infections. So they wouldn't even think that they had it. Unfortunately, some people, especially the elderly with underlying health conditions, are more susceptible to severe cases, and that's what happened in this particular case. They picked it up somewhere, and they got really sick.
At what point in time did you decide that testing was needed in this case?
So this person actually started showing symptoms about 10 days ago. And so during that time, they were doing their regular business, thought they maybe had a cold or the flu, and then they got sicker and sicker. And that's typical for these types of situations. And once the person was hospitalized, then the decision was made to test for a variety of infections. You typically test for the flu and other types of infections, and if those are all negative and you don't know what's causing it, then you'll test for something like coronavirus, and that's when we found out about the infection.
Did this person just go into a hospital? Did they go via an ambulance? I mean, can you walk us through that process? You know, which hospital they went to first, or they didn't transfer since then?
Yeah, I can't share with you, again, for privacy reasons, all the details, but I can tell you that this case is typical of these types of respiratory infections, infections that are passed from person to person through breathing through the air. And typically what happens is the person might go see their primary care doctor, who might say, oh, you know, you have the flu or you have the cold, stay home, take some Tylenol. In this particular case, and in others similarly, they get sicker, so they might go back to their doctor, and eventually they might even end up visiting the emergency department when they're really, really sick, and in some of these severe cases, they're short of breath, which is what takes them into the hospital.
When did they first go to the hospital then?
Can't share that information.
Were they in contact with immediate family members? Are you having more people self-quarantine as a result of this?
Right, so when we hear about a confirmed case of an infection like this, we interview the patient, we find out who they've been in contact with in terms of prolonged contact. So a casual contact like in a market, shopping, something like that, those people are not at risk. It has to be more intimate contact in an enclosed space like a house, and more prolonged contact. So we know who the family members are. They'll be going under quarantine. Quarantine means that they've been exposed to a known case and they need to stay inside for 14 days. If they have no symptoms during that time, then they're released from quarantine. If they do get symptoms like a cough, a fever, a runny nose, then we test them for coronavirus to see if they've been infected.
So in this case, the family members are in quarantine right now?
Correct.
Okay. So at UC Davis, they had several medical staffers self-quarantine. Is that a similar case here where staff workers who come into contact with the patient are also under quarantine right now?
So ask your question again. I was confused by it.
Are any medical staffers who have had contact with this patient gone under quarantine?
Yeah, so that question starts getting a little more complicated with healthcare workers because there's different levels of risk and exposure. So typically, if somebody shows up in an emergency department and they're coughing and they have fever and they're short of breath, the healthcare worker staff would use personal protective equipment, what we call PPE. And the CDC guidelines say that if a healthcare worker has used all that protective equipment caring for a known coronavirus patient, then they do not need to be quarantined. That they're under what's called self-monitoring, where if they start developing any symptoms, then they would go into quarantine. So in this case, it depends upon the level of PPE that was worn by the healthcare workers.
Do you know what the level is then?
We're still collecting that information.
Can you say which part of the county, which city that the patient lived in?
Again, for privacy rights reasons, I can't share that information.
Can you tell us how many tests, how many Yolo County residents have been tested for the coronavirus?
Yes, I can try. If I can remember all the numbers, there's so many numbers going through my head. I think we've tested about 10 people in Yolo County that have all been negative. We have about 4 tests that are pending, and this one just turned positive.
Do you have any other active cases right now, or cases where, they said 4 pending, but what is your current strategy for expanding the scope of seeing who this person may have been in contact with?
So this is what we in public health do on a regular basis for influenza outbreaks, for outbreaks of any infectious disease. We have a staff of public health nurses and a team that work very closely with our healthcare providers to identify who have had contact with the confirmed case and the level of contact and whether they had PPE and public exposures as well, family members, as I mentioned. So that's an ongoing investigation.
But the people who are in quarantine are not tested?
Correct. The people who are in quarantine for the 14 days, the reason they're in quarantine is because they've been exposed to a known case. Not everybody who's been exposed to a known case actually end up with the infection themselves. In fact, most don't, according to our data so far. And so they're in quarantine. They are kept away, it's called social distancing, kept away from other folks for those 14 days. And correct, if during that time they show no symptoms, they will not be tested.
So this individual, when they were showing symptoms, how active were they in the community? Some people, when they're sick, they just stay home, and so they have pretty limited contact, but in this case, was this person going to work, or?
Again, this is like most people who, get some kind of head cold or sickness. I mean, people are going to work and doing their usual stuff until they get to a point where they start developing a fever and get really sick, and then they start seeking health care and limiting their activities.
Do you believe this one patient will lead to more positive cases in the county?
I believe that there's already a widespread coronavirus in multiple counties in California. Not all counties are equal when it comes to that. We've had calls with county health officers all over the state, and there are some smaller, more rural counties where they're not experiencing what we're experiencing in the Sacramento region. But I can tell you in Sacramento County, Placer County, others, there's growing evidence of community-wide spread. So again, appreciate the question. My advice for folks are to stay as healthy as you can by washing your hands regularly. I advise people not to be smoking, not to be vaping any products at this point. This is a pulmonary disease, a lung disease. You want to keep your lungs healthy. Again, wash your hands regularly. If you're sick, please stay home. Don't go to work. Don't send your children to school. We're still in the midst of flu season. There's still widespread activity of the flu. So by preventing the spread of coronavirus, but you're also helping prevent the spread of flu. I don't know if we have questions on the phone as well. I hate to ignore folks on the phone. Oh, we might not have any.
So I know in the past that there's been some issues with testing. Are you seeing, are you able to swiftly test in every case that there may be as a possible coronavirus case?
I appreciate your asking a question about testing. So we have had the last many weeks very limited testing capacity. The CDC has given very clear guidance on who should be tested. And as I shared, it's folks who are symptomatic, have symptoms of a respiratory infection like a cough, a fever, a runny nose, shortness of breath, that have traveled to China or been exposed to somebody with coronavirus. And up until this point, it's only been our public health labs who've been able to test. Even up to the last few days, it was only CDC in Atlanta. We have a public health laboratory that serves Yolo, Solano, Marin, and Napa counties. The lab is located in Fairfield, and they now are able to start testing for coronavirus. So our laboratory testing capacity is expanding. In fact, there are commercial laboratories that have announced that they will be able to test. I believe LabCorp announced today, and Quest will be testing starting on Monday. So there'll be commercially available tests. Those tests need to be limited to the appropriate people. It's not necessary for someone with a mild cough and a runny nose to go into their doctor and get swabbed and get tested. Those folks need to stay at home. There's no clinical or public health reason for those people to be tested. We need to stick to the guidelines for testing for coronavirus.
You mentioned there's 4 pending tests. When can you expect those results?
So those results will be coming back probably in the next 24 to 48 hours. At this point, the turnaround time for testing is 48 to 72 hours. And we've not been announcing negative tests. And I think it's unlikely as we get more and more positive tests that we'll be having press conferences, but we will be sharing as the number of positive tests continue to increase.
Have you been seeing, so getting back to your no reason to go to a hospital if you just have a runny nose, I mean, have you been seeing hospitals overwhelmed with people coming in, having a cough and saying, do I have to get a test?
Everybody who has a cough and a runny nose at this time is concerned that they have coronavirus. And so we're getting a lot of calls, emails and texts from our local healthcare providers asking about a variety of different cases, individuals who are concerned. And again, the vast majority of people who have a coronavirus infection, it is mild. It will go away in a few days. They do not need to see their doctor or provider. If they have questions, they should call the clinic to talk and get advice, but we certainly don't want to be overwhelming the healthcare system at this point.
Could you put a number on how many people are being told to self-quarantine as a result of this one patient?
Well, as I said, we just recently found out the confirmed positive test, so the investigation is still underway.
And those 4 pending tests, are those family members of this individual, or are those possibly community transmitted cases, or are they people who traveled recently?
The 4 cases would be people that met the criteria for testing, which would be travel to China with symptoms, exposed to a person with coronavirus with symptoms, and CDC added another category, which is somebody that's severely ill and hospitalized with a respiratory lung infection where they can't figure out what else it is.
Well, thank you guys. Thank you everyone for being here and for your questions. We will be available offline. If you want my email or my information, I can share that. And thank you so much for being here.